Prior to engaging in any flexibility test, it is important that the patient engage in at least a 5-minute aerobic workout. Then, the patient must select some flexibility exercises to be performed. Examples of these exercises can be found on page 123 to 132 of the ACSM's Resources for Health Fitness Specialists. It is also very important that the patient remove their shoes at all times. Also vital when performing these exercises that the patient stay away from engaging in any fast or jerky movements. Have the client sit down with their shoes removed, and the soles of their feet should be flat against the sit and reach box. The inner soles of their feet should be placed within at least 2 centimeters of the measuring scale. Their hands should be overlapped and slowly lean forward, holding this position for approximately 2 seconds. Always remember, knees should be fully extended and should never be pressed down. To perform a YMCA sit and reach test, place a 15-inch marked piece of tape across a yardstick. That yardstick will be placed in between the patient's legs fully extended. The heels of the patient's feet should be placed at least 10 to 12 inches apart on the edge of the taped line. Next, have the patient overlap their hands, keeping them parallel. Once this is complete, have them carefully reach forward, maintaining that position for at least 2 seconds. The most distant point reached, either in centimeters or inches, will be the score that will be recorded. To ensure that the patient gets the best score possible, have them breathe normally, exhale, and drop their head between their arms when they reach forward, while maintaining their knees fully extended. They should never be holding their breath, and they should never have their knees pressed down. This test assesses flexibility of hip extensors. Have the patient lie on their back. Keep the lower back tight against the floor. Have the patient raise one leg and keep the other leg extended and flat on the floor. Using a goniometer, measure the angle of flexion or range of motion. An angle no less than 80 degrees is respectable, although 90 is preferable. Record and report if the angle is acceptable or unacceptable. Place a folding chair against the wall and have the patient sit on the edge of the chair. Extend the leg with the ankle dorsiflexed at 90 degrees and the heel on the floor. With the legs fully extended, hands palms down on top of each other, head and spine straight as possible, not tucked. Then have the patient slowly lean forward, trying to touch their toes, maintaining this position for 2 seconds. Then run the ruler along the lower leg and record 2 tests and 2 practice trials. The middle of the big toe at the end of the shoe will score 0. Anything short of the toes scores a minus. Anything beyond the toes scores a plus. Record the best score to the nearest half inch.